These days you can find alternative therapists and healers almost everywhere, but generally they still remain outside the realms of modern Western medicine. But now a leading London hospital is turning to a rather unusual form of alternative therapy to help treat its cancer patients. Sadie Nine has more.
5 months ago, I discovered I had breast cancer. After the initial shock, as you can imagine, I decided I would take on any course of action to beat this. After an operation to remove the tumour, I started a course of radiotherapy.
FSD of 97.1.
Every day for the past 6 weeks, I've lain on this table, and I can't tell you how pleased I am that it's my last treatment today. This has been a really stressful period in my life, and to help me through the physical and mental effects of cancer, my consultant has suggested that I try a complementary therapy called Reiki. To you and me, that's healing with hands. I must say, I am a little bit sceptical about this treatment, so I want to find out a bit more about it. Graham King is the first Reiki healer at University College London Hospital, the only one of its kind, and is part funded by the NHS.
What I'd normally do is I'd go into the office, check the paperwork, any referrals that might have been phoned through whilst I haven't been here, look at the patient list, and then maybe come over and talk to some of the staff about the patients that I may be seeing. Is there anyone that I should avoid for any reason?
On the way to meet some of his cancer patients, Graham told me what this type of healing is all about. So Graham, what exactly is Reiki? What does it mean?
Well, Reiki, if you were to split Reiki into 2 syllables, the Rei and Ki, Rei is universal, right, and the Ki is life force. So we channel a life force energy.
Like Tai Chi, that sort of chi?
Very much so, very much, yeah.
Once he starts Reiki treatment, patients often request his services daily. Ursuline was diagnosed with cancer last May. Graham has been seeing her since then, helping her to cope with the side effects of chemotherapy.
Any aches, pains?
Yeah, I've got
specific areas?
My ears are blocked. I have slight migraine. I took a tablet for it. Yeah, and that's about it really. Just up here, blocked.
So, Graham gets to work. It's now all in his hands.
I feel heat, I feel tingling sometimes in the hands, but most of all it's like a connection with the person I work on, that it's a calmness, it's an empathy towards the person I'm working with.
I have some sessions where I went till I actually felt I was floating. Once you're relaxed, it makes you very, very relaxed. When he moves all these negative energies out your body, then your feet gets really hot and then it comes out through your system.
How's it helped you, this treatment with
Well,
Graham?
anytime I'm stressed, I call him. I call him at home. He deals with my stress, my pains, any discomfort I have in my body. He works it out. And I tell you, if it wasn't him, this Reiki, I didn't know how I'll be able to make it, because it's very good. It helps out. It's a good complement for normal conventional medicine.
For the past 8 years, Graham has been a full-time healer, but he's not medically trained. That's because there's no officially recognised qualification for what he does. So in theory, anyone could call themselves a Reiki healer. And there's no clear scientific evidence that the complementary therapy has any impact on patients at all. So I wanted to know why a renowned hospital like the UCLH has decided to employ him.
Most people would make the assumption that when you introduce healing in this kind of environment that it's all kind of rather nebulous and rather difficult to evaluate. Our experience is quite the opposite. Quite often we'll have patients who have almost intractable nausea type symptoms, meaning that they're just very difficult to control, and we've thrown a lot of drugs at the problem and yet the patient's still nauseous, and then we've sent in the healer and seen a much improved response.
So this is a physical thing?
Yeah, there's certainly a question of how much of therapies, especially like healing, have a placebo effect. To our mind, even if it's a placebo effect, we don't care, because patients clearly benefit from it.
So scientifically, what do you know about the way that Reiki works?
Well, the honest answer to that is not very much, and nobody does. We are about to do a scientifically based study, which is the first time we've tried to evaluate the healing in this way. And what we're going to be doing is measuring how quickly patients recover from their chemotherapy.
Those tests could lead to the first scientific evidence about the effects of Reiki. Until then, all we have is increasing anecdotal evidence from cancer patients and their families that this treatment works. And Sophie Johnson is part of one of those families. Last Christmas, her 2-year-old son George was diagnosed with a malignant tumour on his brain.
George has got it on the right lining of his brain, so behind his right eye, and it's all sort of behind his eye and behind his nose. It's quite a big lump. When one gets ill with a temperature, you worry. So when you're told that you've got a 50 to 60% chance of survival, it's not nice. He was very anti-nurses, anti-doctors. As soon as someone would come anywhere within 5 yards of his bed, he'd be screaming, "Away, away," really, really aggressively, and just not nice to any of them.
Weeks after George was diagnosed with cancer, Sophie asked Graham if he would help him. The results were remarkable.
And as soon as he had the Reiki, he was literally a different boy. All the nurses and the doctors on the wards were saying, "Wow, what's happened to George?" And I said, "Well, he's been Reiki'd."
What surprised Sophie most was not only the change in George's attitude, but also the physical changes that happened.
He always had a blocked nose at the beginning of the treatment, and because of where the tumour was, it was right sort of downside of the nose and the nasal pharynx. As soon as he had Reiki, that started clearing, and he actually had a free-flow running nose, which is absolutely brilliant for us to see. And we've since gone on to have very positive scans.
I have spoken to so many people in a much worse situation than I am who all say that Reiki's helped them. So I've made an appointment to see Graham after work today, see if he can help me. Graham started at my head and worked his way slowly down my body. I felt his hands above me and an intense heat sear right through me. My right cheek was tingling. I began to relax. Even though he wasn't touching me, it felt as if his hands were burning hot. I could feel the heat through my clothes. 30 minutes later, I felt drained, as if all the energy had left my body. Wow. I couldn't move. Graham had to help me up. I wouldn't feel the impact of the treatment until the next day.
You have to cure people, but they need to cope while they're going through that treatment. And healing is one part of the armoury which enables us to do that, and patients tell us it's important.
The following morning, I really began to feel the effects of the treatment. I felt completely recharged. I can't say that I understand what Graham's healing did for me, because I don't. But something definitely happened.
Well, if you'd like to know more about that story, then log on to our website. The address is bbc.co.uk/insideout, and don't forget to click on London.